Well, hello everyone. So today we're going to be doing a Gestalt, a role-play scene based on Gestalt therapy. And in our role-play scene, I will be playing the therapist, and Katie will be playing the client. So Katie's been coming to me for several months now due to her level of anxiety, which has started to impact her daily functioning. So we've been working on coping skills and ways to diminish her feelings of anxiety. And over the past several sessions, we developed a therapeutic report. And Katie feels comfortable expressing her concerns with me. So today, Katie has come to therapy with a specific anxious problem. She's feeling anxious about a presentation involving public speaking that she has to give within a month at her staff meeting. Hello, Katie.
Hi, Jeff.
Hello. And welcome. So what's going on with you right now?
Well, I know we've been working on my anxiety for a while now, and I really thought I was getting a handle on it. I've been able to get through meetings and go to happy hours with my coworkers. I even asked my boss for help on a question that I had at our staff meeting. But earlier this week, my boss told me she needed me to give a presentation at our next staff meeting, and I'm so stressed and worried about it. I don't know what I'm going to say, and I don't think that any amount of practicing or rehearsing is going to make it any better. I know I'm going to mess up and say something stupid, and all of my coworkers are going to laugh at me, and my boss will never trust me with something this big ever again. Maybe I'll just call out sick that day. I know it sounds really silly, but I wouldn't have to give the presentation, and it might be easier for everyone that way.
Mm-hmm. Okay, so I understand, Katie, and please stop me at any time or correct me if I get any of this wrong. But I understand what you've been saying here is that you experience a lot of new anxiety issues related to public speaking at work, and that you sometimes experience so much anxiety you feel the need to call out sick, or possibly call out sick. And you're also concerned that you feel that no amount of practicing will help, and that your stress level is causing you to worry that you may do something which you deem to be foolish, and your coworkers will laugh at you. Your boss will also be unable to trust you with something this big again. Is that about the gist of it?
Yeah, I've never been good at public speaking, and now I have to do it for work.
Katie, tell me how you're feeling about this right now.
I feel so nervous. I feel like my stomach is all tied up in knots, and my presentation isn't even until next month. It's all I can think about, and stuff that doesn't usually make me nervous is making me anxious. Like taking the bus. I don't have any appointments after this today, but I'm so worried about getting to the bus on time when I could easily just take the next bus that comes.
That's understandable. You're thinking so much about your presentation. It's affecting normal situations that you typically wouldn't get nervous about, like not wanting to miss the bus, even though you have no more appointments. So it sounds like your anxiety related to your presentation coming up next month is really starting to affect your daily life. Does that sound right?
Yeah.
Okay, well, what or how are you feeling about that? And specifically, where are you feeling your tension and anxiety? Can you pinpoint that area for me?
It's everywhere. My stomach feels all twisty and knotted. My chest feels so tight, like it's hard to breathe, and my arms are trembling, and I can't even keep them steady. It feels like there's an earthquake going on that only I can feel. And my neck is really tight, too.
Well, Katie, I noticed you're holding your arms crossed and your legs have been shaking when we've been talking here. Is there a significance to that? And what are you feeling with those body movements? Did you notice you were doing that? And is this the earthquake you're referring to that only you can feel?
I noticed my arms were crossed, but I didn't realize my legs were shaking. I think I'm trying to control the shaking in my arms, which is why I'm crossing my arms. But I guess by trying to control that, my leg has started to shake instead.
Katie, do you think you can exaggerate those movements? Do them just like you feel?
tried.
Okay. That's great, Katie. Can you do that again? That's a great job, Katie. This time when you're doing that movement, can you tell me how it's making you feel?
It feels like I'm trying to kick away my anxiety, but it keeps coming back like a yo-yo or a boomerang.
That's a good metaphor for your anxiety. So, do you think you could sit with that anxiety of it? You feel like you're trying to kick it away and it's coming back like a yo-yo. Could you sit with that for a little while and reflect on it?
Sure.
Okay. Reflect on that. And when you're reflecting on this, thinking about like it's coming back like a yo-yo and you're kicking that away, what are you feeling about this and why do you think you're feeling this way right now?
I guess I've just been so caught up in prepping for this presentation and trying to figure out how to work through that I've forgotten how much I rely on my coping skills to keep my anxiety at bay and to help me get through the day.
Mm-hmm.
I feel like I've lost control because I'm not able to control my anxiety about work right now.
Mm-hmm. So I think I hear you saying you've been so preoccupied or involved in preparing for this presentation that you haven't realized how much you rely on your coping skills to get you through daily life. And you feel out of control over what you feel is your inability to control your work-related anxiety. Is that about right?
Yeah.
Okay. You know, Katie, then I'd like to try something with you right now. It may require some imagination on your part. Do you think you're up for that?
Sure.
Okay. In Gestalt therapy, we use something called the empty chair technique. And it's a good technique that allows you to talk to both sides of yourself and to help work with emotions you're feeling. Work versus private, Katie. Would you like to give that a try?
Sure.
Okay. I'm gonna put this chair up here. And I want you to imagine that work, Katie, or the part of you that is anxious about your work presentation, is sitting in this chair right now. And what would you say to her?
And it feels kind of silly.
Okay.
But I guess I would say you need to take some deep breaths. Because if you can't figure out how to deal with this presentation, it's going to mess up all the work you've done in your personal life.
Okay, good. So Katie, would you mind switching seats now? And now you're going to be work, Katie. So I want you to try to imagine now to get into the mindset of work, Katie. And as you're thinking that, what would you say to the private life Katie, or how would you respond now to the private life Katie if she were right there?
You think it's so easy to just suck it up and force this presentation to work. At home and with my friends, I have so much support. At work, I have to do this all by myself. There's no one here to help me or support me or guide me. And I'm flying blind and nothing that I've done in therapy has prepared me for this. I've tried all of my coping skills and nothing's working. So of course it's impacting me in other places. But I have it so easy in my personal life instead.
Good. Well, thank you, Katie. Now I'm going to ask you to switch seats again if you don't mind. Okay. Very good, thank you. I'll just move this out of the way. So, Katie, what was that experience like hearing both sides of yourself discuss this?
I didn't realize why I was feeling so stressed about this presentation or why it's impacting my outside life. But what I said is true. I did try all of my coping skills and none of them worked. My last one is usually to ask somebody for help, but I'm not really close with anybody at work yet. And if I asked for help, I think I'd feel inept and unqualified to even give this presentation if I asked for help.
Mm-hmm. Okay, so you tried all your coping skills and you think none of them have been successful. Mm-hmm. I understand. I think that's totally relatable because first of all, it's often hard to ask a colleague at work for help, especially if you feel you're not close to them. Plus, the stress and the pace of the work environment sometimes doesn't even lend itself for disclosure or assistance. So, in addition, asking for help with your presentation can make you feel like you're inept, basically. Is that right?
Yeah.
Okay. So, Katie, I'm thinking that maybe we need to think of some coping strategies specifically for this presentation. And that way, Katie can feel a little more in control. Does that sound okay?
Yeah, that'd be great.
Okay, great. So these techniques we've done here today with the empty chair, do you think you could try to apply some of those next week?
Yeah, I think it was really helpful.
Okay, great. And I'll think of some other things too with regards to the empty chair. And maybe you can take away what you've done today, try to apply some of this, whatever you can take away from this session over the course of next week, and we can continue doing work Katie, private life Katie, with the empty chair technique if that's something you're comfortable with.
Sure.
Okay, great. Okay, great, Katie. Well, that would be great, and I'll see you in about a week.
Thanks, Jeff. See you next week.
See you next week.
All right. So in this short role play, Jeff and I used Gestalt theory, highlighting the empty chair technique, body awareness, and an attempt to keep everything present focused on the present emotions and feelings going on, which is a highlight and a hallmark of Gestalt theory. We chose this theory because we liked the honesty that was involved in the theory, and that was involved in this application of it.
Yes, and we also liked aspects of Fritz's tough love approach because we thought that allowed the client to reveal her true self, and that she wanted respect and to be respected. And I think that's what happened with the Fritz analysis, even though it was the older version of Gestalt. We liked that part of it.
Mm-hmm. We also appreciated the emphasis on body awareness and present focus present in the theory. It seems that this emphasis would help clients moving forward and towards a greater level of self-understanding.
Mm-hmm. If we contrast Gestalt with another theory, like for example, psychoanalytic theory places a strong emphasis on the past, which contrasts with the present focus of Gestalt therapy.
Mm-hmm.
And psychoanalytic theory also emphasizes the knowledge and insight of the therapist over the client. In Gestalt, the client is viewed as the expert of their own experiences, and the therapist facilitates the client becoming more aware of the bodily felt experiences.
Mm-hmm.
And in psychoanalysis, also emphasizes the unconscious drives and mechanisms that underlie behavior. Gestalt theorists seek to help their client understand the emotional, moment-to-moment experiences occurring in their bodies, their consequences, and their motivations through the development of present awareness. And also, psychoanalysis tends to emphasize the mind, while Gestalt tends to focus on the body.
Mm-hmm. Now, Gestalt therapy in this context did have some multicultural considerations to take into account. Jeff and I both identify as white, but present in this dynamic is the idea that I'm a woman, identify as a female, and Jeff identifies as a man and as a male. So that dynamic plays out in our therapy and could have potential implications for our therapeutic relationship. But in this role play, we did not experience that dichotomy, I don't think. But Gestalt therapy in many ways defies cultural norms of what therapy will look like in the first place. As a therapist using Gestalt theory, it is important to recognize that this approach may appear unconventional to many individuals who expect a traditional talk therapy approach. It may be important to understand a client's preconceptions and experiences with counseling, as well as their goals and presenting concerns. Gestalt therapy, the client is viewed as the expert of their own body and inner experiences. Some individuals begin counseling expecting the therapist to be the expert, but they would be very surprised by the amount of insight and amount of control that Gestalt therapists expect their clients to develop. It's also therefore important to understand the cultural history and expectations that clients have. Gestalt therapy can appear confrontational at times, which may make some individuals nervous. Our text, Gerhardt 2016, specifically mentions individuals who identify with Asian culture may have difficulty with a Gestalt approach because of the present focus on the body and emotions, as well as the confrontational tone present in moments. Gerhardt proposes that the empty chair technique may provide a way for individuals identifying with Asian culture to safely express emotions, especially with authority figures, in a productive manner.
And in Gestalt, we looked at the strengths versus the limitations. And the strengths of Gestalt therapy is that it's excellent for bringing awareness to the therapeutic self or the body experiencing the present. And also in Gestalt, there's a mindfulness component to it. It's intriguing because it keeps with the current cultural trends of mindfulness and presentness, and which is what we did here today. And opposite of the psychoanalytic theory, which focuses on the past, the Gestalt theory is all about the present. And also, Gestalt theory can be a physically active theory. As a result, it can create intimacy, which is the strength that the therapist and client can build on. And we did a little bit of that today with the physical of the empty chair technique.
And also identifying that I was kicking my leg and crossing my arms. Some of the limitations that accompany this theory are sort of the tail ends of the strengths as well. So strengths and limitations, the limitations include things like neglecting personal identity, which often has a lot to do with the past. With such a strong emphasis on the present, it sort of neglects that past history and experiences. So perhaps this approach may not be best for someone who has a traumatic past, and they need to process those personal historical experiences before being able to move forward. This approach may not necessarily be the best approach for them. Additionally, the tough love and physical approach of this therapy can be off-putting to some people. It can be confrontational, which may not be effective with clients who require a little bit more of a gentle and empathetic, openly empathetic approach, like individuals with major depressive disorder or individuals who have psychotic features to their diagnoses.
And we also discussed how we can incorporate the Gestalt therapy or the theories within our creative arts therapies or CAT specialties. And for music therapy, I think dream analysis could work best with receptive music therapy methods, such as selecting music that matches different selves and emotional experiences in a client's dreams. For example, you could use classical music for peaceful dreams, and more intense music like rock, rap, heavy metal for frightening or intense dreams. And then also Gestalt therapy could work well with guided imagery, because guided imagery with music can be paired with Gestalt dream analysis techniques that can go really well together. And live music can be employed in all phases of the integration sequences. The discovery of new realizations of the self can be linked with music that either the client picks or has the music therapist play. And the client can improvise or engage in creative activities through the process of discovering true self, like the assimilation integration. These activities can include improvisation on the chosen instrument, like you could do black key piano improvisation, or if your client is feeling anger, frustration, percussion, or creative lyric writing or rewriting to a favorite song to make it personal to the client. Like example, during the assimilation stage, the client can create new lyrics to original or favorite song in order to realize who the real client is and what they feel like. And yes, and the empty chair technique can also be linked with creative music therapy exercises previously mentioned, like creative lyric writing, singing a song to the chair, or the imaginary chair person or other part of the self, so as to become the whole person. And then finally, clients can engage in creative improvisation or music therapy, lyric writing, or music listening exercise, either of their choosing or with the music therapist's help. And this could be like a guided fantasy technique where the client can visualize the here and now experiences through the music.
And Gestalt therapy and Gestalt theory align really well with a lot of the tenets of dance movement therapy. There's a strong emphasis on body awareness and the connection between the mind and the body in both DMT as well as in Gestalt theory, making them a uniquely linked pair of approaches and techniques and perspectives. A tenet of dance movement therapy is meeting the client where they are in the moment. The emphasis on the present moment in dance movement therapy aligns with Gestalt theory, although dance movement therapy is rooted in a more psychodynamic perspective. So it will explore components of the past by exploring the body in the present moment. DMT relies on the motivations of the client and the inner impulse to move. Gestalt therapy appears to be driven by the client's moment-to-moment motivations and experiences. Both Gestalt and dance movement therapy are physically engaging and active therapies, using the body and its ability for self-expression, both consciously and unconsciously, to explore the mind. So thank you so much for watching our role play video. Jeff, you're a great therapist.
Well, thank you. You're a great client.